If you don't want to, if you don't want to listen to this demonstration, you don't have to stay in the room. Okay, we're going to look at the face, and let's, you know, in relationship to what we can see at this level, does anybody get better contrast, do you think?
I will go in there.
But up here on the scalp, where you started to dissect the other day, you can see the highlights of these muscles under here. These are the frontalis muscles on each side. Let's see if we can come up with a supraorbital nerve. Okay, so this nerve right here that's coming out from under the upper eyelid, this is a portion of the supraorbital nerve coming out over here. Let's see if we can find a supratrochlear. Probably some of the fibers in here, supratrochlear. You can see a little bit of it right there. Supratrochlear fiber. Some of the muscles that we see on the face, let's look at those first. This was a frontalis. This around here is orbicularis oculi. Down over here on this structure right in here, this is the parotid capsule. So the parotid gland is in here. Probably have to get this so that we're tilted to the side to see these, because otherwise I don't know how we're going to see this over here. I mean, okay. Okay. That, yeah. On this side. I want to look as much from a lateral view as possible. There. Hello. Okay, right there. Good. Stop. All right, right at the bridge of the nose, there are actually a couple of small muscles. There's a muscle that comes down from this glabella. It's a very thin muscle. It's called a procerus. It lies on top of the nasal bones. And then there's another muscle a little bit more lateral that comes out to the side, and that's called the nasalis. There's a muscle, if you can dissect it out, it's very thin. You can just see some of the fibers in it here. It's called a compressor nares. That closes down the airway. As we look more down underneath here, you can see that there is a greater extent of muscle alongside the nasal chamber, and then there's an extent of muscle that's coming down to the upper lip. Okay, this is the aliquinese, and it's joining the levator labii superioris. That's the levator labii superioris aliquinese. As we come down here, you'll notice this structure over here. This is a blood vessel. This is a branch of the external carotid facial branch. This is called a superior labial. This muscle that's coming down, let's see, I think we've got a little bit here. Not quite as typical, but this muscle here coming down from the zygoma to the corner of the mouth, that's the zygomaticus major. And this, I think, was probably part of zygomaticus minor. I say part because it would usually be a little bit wider than that. Then as we go a little bit deeper here at the corner of the mouth, there is a muscle kind of, let's see if I can get some of this fat off of it. And there's another labial branch coming in here. There's a muscle here in the superficial fat that is pulling up on the corner of the mouth. That's levator angula oris. And then there is a muscle that goes around the oral cavity. This is the orbicularis oris. If we come down to the lower lip area, this muscle that corresponds to this levator angula oris here, this is the depressor angula oris. One of the ways of telling what that is it's triangular shaped. So an old name for it actually was triangularis. You come a little bit farther towards the midline and we have this muscle here. This is the depressor labii inferioris, and then in the midline there's kind of hair-like muscle fibers coming out at you. That's the mentalis. Okay. If we go a little bit deeper on this side, I don't know if we can see it. There are two muscles here. This muscle that I'm rubbing my finger over and over its anterior border, that's actually a muscle of mastication. That's called the masseter muscle. And then right in front of that, deep to that, is a muscle of facial expression, and it's right here in your cheek. That's the buccinator muscle, deep in there. And to get to that, you have to cut out an encapsulated fat pad called the buccal fat pad. The platysma muscle has been cut free from the mandible. We can see it kind of under here. We see the facial cervical branch coming into it from above. Let's see if we can see mandibular branches here. These branches, there's a little bit of fat around them. We'll have to clean this up a little bit. And you see this nerve coming down here. These are mandibular branches that are going to be wrapping around. They actually go down and then they ascend. They go down to the lower border of the mandible and then they come up to the musculature. And these are mandibular. Sometimes because they do that, they're called marginal mandibular because they run along the mandibular margin. Other facial nerve trunks, let's use another reference structure here. This is the parotid duct. The parotid duct actually comes from the gland and it pierces the buccinator muscle to its opening comes into the oral cavity in the posterior area. The parotid gland is back here. So the facial nerve is branching through the parotid gland. Here we see some of the larger branches. these branches down here that are coming into the cheek, these are buccal branches. Some of them will go above the parotid duct, some of them will go below. Here's another branch here. There are branches of the facial nerve that come into this zygomatic region. Let's see if I can find them again. Here's one here. There's another small branch here. The zygomatic branches will go to the musculature that's under the lower eyelid. And then there's a large nerve trunk that comes up here alongside the scalp behind the eye and actually goes to the muscles like the frontalis and the upper portion of the orbicularis oculi to the upper eyelid. So that's one way of determining what those vessels are. If we go back a little bit farther and we see over here, we see some of the blood vessels that are coming up to the scalp. This is a superficial temporal artery. Adjacent to that is, running very close to it, I think, is a superficial temporal vein. And then in this grouping here, we can see there's some thin nerve fibers coming up here. Those are auriculotemporal nerves to innervate the side of the scalp. So this is right in front of the tragus of the ear, this little bump in the front of the ear. So we can see those. If we come down to move this platysma muscle a little bit, we can see the facial artery coming up onto the face. Here's the artery right there, and it's also right at this point it's giving off a inferior labial artery, and then continuing up, and it gave off this superior labial artery. And then behind that a little ways is the facial vein. Okay? So remember what I just told you in class, that the vein always runs behind the artery. Okay? And usually it'll maintain its venous position. Here's the submandibular gland, and the artery basically runs through the substance of the submandibular gland as it comes up to the face. Okay, now, once again, when you do this dissection, you don't have to go deep. You're just going just through the skin. Remember, these muscles have a bony point of insertion, but there's, a bony part of origin, but their insertion is into the skin. So you're basically, as you're going in, you are cutting away their insertion point. So you have to kind of get them, and then you have to push them away, push them down towards the face, and then flatten them out to see them more clearly. See anything else here? Okay. I brought the heads in yesterday afternoon, and we'll start taking a look at those on Monday. Okay. Some of the heads will show some of this a lot clearer than we see here at this point, but this should keep you busy for a couple hours.
Do you want to do this temple process? No.
Not now.
Later?
Do that Monday. Okay?